Thanks for staying with us. Let's go to this conversation now. The Northern Cape, of course, is the province that has seen the second lowest HIV prevalence rate in the country. And this is according to the findings of the 6th South African HIV Prevalence Incidence and Behaviour Survey that were done by the Human Sciences Research Council. And of course, this is quite an important conversation as we discuss some of the factors that are in play here, and also what are we seeing in terms of the demographic, in terms of the geographic differences as well when it comes to different provinces. As you can see there in picture, we're joined by Mr. Adlai Davids, Senior Research Manager for Public Health Societies and Belonging Research Division of the Human Sciences Research Council. Good evening to you, sir, and thank you so much for your time. Firstly, what do we attribute the figures that we are seeing here when it comes to the second lowest HIV prevalence rate in the country, in the Northern Cape?
Yeah, good evening to you. What we've seen in the Northern Cape is that it has a very low prevalence in the 0 to 14 group, which means that your mother-to-child program in this province is working well. It has the lowest of all the provinces at around about 1.6. It was a change from 2017, but that helps that it starts so low. So that's one part of the answer. And the second one, in terms of the changes in the prevalence, we do see that the peak is in the middle age group. But what is quite promising and quite encouraging is that there is in the 20 to 34 group, age group, when we compare the figures we have in 2022 with that, what we seen in the previous survey in 2017, there's been quite a significant drop. And when you have that figures, it means that it is a very promising movement.
And there's also, of course, something I was watching, when I was reading here, that HIV prevalence is higher in females, particularly than in males, among those aged between 25 and 49. Any reasons for this?
Well, biologically, you do find that women are more prone by virtue of that to acquire HIV than are men. Even in the same age groups, you've mentioned the figures that there's quite a disparity, and that is one of the reasons. And we also find that perhaps in those younger age groups, in general, men, for example, are less likely to test for HIV and to initiate on treatment. So that is, in terms of that, it is an issue. Why a contributing factor to why women are then, or females are more affected by HIV than men, especially in the same age cohorts.
And it's quite encouraging, though, to see that the antiretroviral coverage when it comes to the province has increased over the years.
It is a very encouraging, as you quite rightly say, because in terms of the targets that UNAIDS has set for dealing with HIV by 2030, in terms of the 15 plus, what we saw in the Northern Cape was that their numbers for that first 95 in trying to get people who are HIV, living with HIV, to try and get them to be to know their status. They came to about just over 90 at 91.5, but then for the second and the third 95, the second one is those who know their HIV status and gets initiated on antiretroviral treatment. That's almost at 95%, at 94.7. And where we do find that those people who are on ARVs become virally suppressed, in that they would, and that figure for Northern Cape was 97.4. So that helps to encourage the epidemic. Although the peak that we saw in our study, in our findings for the Northern Cape, is a little bit not as encouraging, because we want the peak to move throughout the age groups that we have in the population, but we want it to be the peak should move to the older age group, but the peak should drop. And what we saw in the Northern Cape, though, is that whereas the peak in 2017 was in between 30 and 34, the peak is now moving in the right direction to the 35 to 39 group, but it's a higher, about 1.4% between the two surveys. So that is means to us that even at that age groups, people are still acquiring HIV and not doing the preventative things like safer sex, limiting multiple sexual partnerships, and when people do acquire HIV, to be on ARVs and then becoming virally suppressed, which helps with stopping the spread. So this is the stuff we still need to work on in the Northern Cape.
And also, of course, when we were discussing this, because we've been looking at it in various provinces, there's also, some provinces as well showing a concern around adolescents and how some of them remain unaware of their status. For example, others are simply not, practicing safe sex. What did you find in the Northern Cape in this regard?
Yeah, that is for us is that age group that you've in terms of being unaware of the status, is that adolescents in that 15 to 24 group, they, for example, have a disproportionate gap in treatment, because only about they just 8.1% of all the people who live with HIV in this province, but 11.8% of those are unaware of their status. So if you have a group of that age at 15 to 24 who is then quite sexually active, that means that you actually carry on spreading the disease and infection, especially if the sexual partners are of the same age cohort, and we don't want that. And then when they're not up to almost just over 9% and unaware of the status, and then if they are aware on only 9% being on ARVs, then you also see that the drop in viral loads, levels of viral load suppression is also very low. So the reason why we really want to see in Northern Cape and all other provinces people being on ARVs is that when you become virally suppressed, the virus load in your blood becomes undetectable, and when it's undetectable, it becomes untransmissible. So which means you have another mechanism whereby you can lower prevalence on the road to actually becoming an AIDS-free generation.
And as a final question then, briefly, when it comes to PrEP, I see that some of the adults are simply either aware of it but not using it, and thus possibly signaling that there might need to be a lot more work done there.
What is very encouraging is either people knowing about it. Unfortunately, we don't see a lot of people in the Northern Cape being on it, but when they get described and know what is the PrEP, a pre-exposure prophylaxis all about, and as a mechanism to prevent HIV infection. In the Northern Cape, we've seen more than 85% of people saying, should this become available, we will be willing to take it. So what we find is that there's definitely an avenue to limit the spread of HIV, and I think the colleagues we had the dialogue with today are very acutely aware of the issue, with Northern Cape being such a vast province with very low population densities, but the realize from a health system perspective that this is something that it's an avenue that's opening up, and we hope to see that when we do this again, this kind of things will be in place, and we'll see the changes happening.
Yeah, and as you say, I mean, we've been looking at different provinces, and it's interesting how people are sharing the same sentiment that should it, be available, or I know more and all of that, I can definitely take it. So it does seem to suggest that a number of people are looking for more information in it. So certainly a need for a drive there. But thank you so much for your time, and it's certainly encouraging to see some of these numbers and the strides that are being made in HIV treatment, particularly in the Northern Cape, with the strong antiretroviral coverage as well. Thank you so much for your time. That's Mr. Adlai Davids, Senior Research Manager at Public Health Societies and Belonging Research Division of the Human Sciences Research Council.